Hey, welcome back, everyone. And we are at 5.0 on the PDF outline blueprint, the PTCB blueprint. And today we're going to talk about the pharmacy quality assurance. Pharmacy quality assurance. So, pharmacy quality assurance with regards to medications is a wide-ranging concept covering all matters that individually or collectively influence the quality of a product. With pharmaceuticals, quality assurance can be divided into major areas: development, quality control, production, distribution, and inspection. All right, 5.1. Quality assurance practices for medication and inventory control systems, for instance, matching the National Drug Code, the NDC number, and barcodes and data entry. So quality assurance practices for medication inventory control. Okay, A, QA in the pharmacy, quality assurance. Quality improvement is not optional. Medicare Part D, when OBRA 90 was passed, Medicare Part D required participating pharmacies to implement a continuous quality improvement program, otherwise known as CQI. So do a growing number of third-party payers in the private sector and a growing number of state pharmacy boards. B, NDC, National Drug Code. Type that in and write it in. National Drug Code. So every manufactured drug in the United States has an assigned NDC number that is unique to that manufacturer, the drug name and strength, and packaging. It is always 11 digits, always 11 digits in the format 5, 4, and 2. 5 digits, dash 4 digits, dash 2 digits. The first set of numbers, the 5 digits, is the manufacturer. It's always the same manufacturer for those 5 digits. The second set of numbers, the 4 digits, is the drug product strength as defined by the manufacturer. And the last 2 digits are the package size defined by the manufacturer. So, for example, the NDC, or National Drug Code, of Prozac 20 milligrams is 00777-3105-01. So the first set, the 00777, is the manufacturer Dista. So whatever Dista makes, all their products, the first set of numbers, the 5 digits, is always going to be 00777 because that is Dista. The second set of numbers, the next 4 digits, 3105, that always stands for Prozac 20 milligrams. So that's Dista's product or ID, product ID for Prozac 20 milligrams. And then the last set is the package size 01, as defined by Dista, which is a bottle of 100. Now, I wanted to show you here an NDC number. I'm going to put my finger on it, and you're going to see here. See that? So 60505 is always Apotex. And then 1329 is always going to be metformin hydrochloride extended release 750 milligrams. And then 1 is their package size for a bottle of 100. You notice how the 1 only has 1 digit, so in that situation we have to add a 01 to it. Okay, so when the leading 0 is left off in the NDC, always make sure to add the leading 0 when inputting the NDC into the pharmacy computer system, because you have to bill for that drug to the insurance company, and they're not going to take it if you don't have 11 digits. So if it doesn't have 11 digits, add the leading 0. So for example, if it said 0781-312-01, it should be entered as 00781-0312-01. Remember the format, 5, 4, and 2. The first 5 digits are the manufacturer, the next 4 digits are the product ID and strength, and then the last 2 digits are the package size as defined by the manufacturer. 2, checking the NDC on the bottle is always good practice and an accurate way to make sure that the right drug is inputted and pulled from the shelf. All right, let's go to page 2, everyone. The barcode. A barcode is another way to ensure accuracy when filling and dispensing prescriptions. Most pharmacies have bar scanners to scan barcodes on bottles and prescription receipts to ensure that the right drug is getting to the right patient. D, data entry, typing in data into the computer system. Technicians will input data into the pharmacy computer system when processing prescription orders. That's usually either the pharmacy technician or pharmacy clerk. Because this is often a manual process, prescription error rates are often the highest at this level of dispensing. Yeah, it's unfortunate, but it happens here when inputting. So one, always double check the NDC numbers and double check the patient information, especially when they are new to the pharmacy. You want to get all their information correct. And then three, minimize interruptions or social conversations. Do not be doing this, you guys, when engaged in data entry tasks. This is often one of the most intrusive causes of mistakes for technicians, because you got to get it right. You can't be typing in the wrong information into the computer, because if the pharmacist misses it too, the patient could be hurt by those mistakes. Okay, 5.2, infection control procedures and documentation. So for instance, personal protective equipment and needle recapping. A, infection procedures are often associated with aseptic or sterile technique in an inpatient pharmacy setting. The definition is to provide clear guidelines for pharmaceutical staff on the correct procedures for preparation, storage and monitoring of sterile products compounded in the pharmacy, and to prevent contamination of sterile products prepared at the pharmacy. B, aseptic technique procedure A. Failure to utilize aseptic technique can result in contamination of the pharmaceuticals. So we got to make sure that our aseptic or sterile technique is perfect. Let's go to page 3, top of the page. 2, remove any hand, wrist jewelry, and scrub nails, hands and forearms with an antimicrobial soap before handling sterile products. Remember how long you wash your hands for? 30 seconds. 3, do not eat, drink, or smoke in the preparation area. 4, avoid touch contamination of sterile supplies. 5, wear a gown, face mask, shoe covers, hair covers, and where applicable, a cover for facial hair upon entering the preparation area. 6, personnel engaged in compounding intravenous IV admixtures should always wear sterile gloves. Gloves should be removed when exiting the preparation area. Glove personnel should not answer the phone, obviously, especially your cell phones, right? Number 7, procedures should be developed to validate the aseptic technique for each person preparing sterile products and repeated at periodic levels. Okay, C, aseptic technique procedure B. So 1, all sterile products, CSPs, should be prepared in a class 100 environment. That is no greater than 100 particles per square foot, which can be achieved with the use of a certified vertical or horizontal laminar flow hood. This is also ISO class 5, right? 2, use of the, ready? Type it in or write it in. Use of the laminar airflow hood, or laminar flow hood, laminar airflow hood. Okay, we're going to talk about this for a moment. So you want to operate the laminar airflow hood continuously. Before processing sterile products therein, it should be in operation for a period of time long enough to purge air from the work area. You remember the amount of time, so if you left at night and you turned off the laminar airflow hood and you came back in the morning and you have to turn it on, do you remember how long? Well, yes, 30 minutes. At least 30 minutes, or as per manufacturer's recommendations. So look for that answer if it asks you, how long do I have to leave the laminar airflow on if it has been turned off? And the answer is 30 minutes. B, do not disrupt the airflow between the HEPA filter and any sterile objects to avoid contamination. Remember this? If you have two products, if you have a vial here and you're on a horizontal laminar flow hood where the air flows from the back to the front towards you, you don't want to, assuming this is on the workbench, right? You don't want to put something in front of it. You don't want to put something in front because the air It would obstruct the air to flow in front of the vial that's in front. If it's a vertical airflow or a biological safety cabinet, remember that goes from the top to the bottom. The airflow goes from the top to the workbench. Obviously, you don't want to like put your hand over the vial on the workbench because you're going to block the airflow over the vial. Okay. And then remember, complete all work at least 6 inches inside the laminar airflow hood. So your workbench is here. Remember, 6 inches from the edge of the workbench. You don't want to be working on stuff, with your syringe and your vial out here, because this is not 6 inches. You got to be in at least 6 inches. That will be a question on the exam if you get asked. It's 6 inches. D, Aseptic Technique Procedure C. Let's go to page 4. And number 1, disinfect the work surfaces and all accessible interior surfaces of the hood with a hospital approved disinfectant before beginning work. For most hospitals, 70% isopropyl alcohol is approved as a disinfectant. And you also what's approved is 70% ethanol or ethyl alcohol. 2, clean the exterior surface of the hood daily with a hospital-approved disinfectant. 3, inspect the containers of the ingredients used to compound the sterile products for defects, product integrity, and the expiration date noted. 4, do not use defective products or expired products when compounding sterile products. 5, disinfect the entire surface. Disinfect the entire surface of all vials. When you pop the cap, you want to disinfect it with an alcohol prep. IV bag nipples, ampules, everything with 70% isopropyl or ethyl alcohol before entry into the laminar flow hood, and then allow to dry. 6, handle all ampules, vials, needles, and syringes in such a way as to maintain asepsis or sterile technique, and avoid unnecessary turbulence with the laminar airflow hood. 7, ensure annual certification of the laminar airflow hood or more frequently as needed, and maintain certification records. That's not going to be your job, that's going to be the pharmacist's job or the pharmacist in charge. 8, maintain a cleaning log on a clipboard next to the laminar airflow hood to record all cleaning and maintenance cycles. So when you're in your laminar flow hood, there'll be it's usually glass or like plastic on the sides. You want to make sure you just keep the clipboard on the outside of the glass or plastic where you're going to maintain your cleaning logs. E, needle recapping. Never ever, never recap needles in the laminar airflow hood after removing the cap from the needle. Always dispose of all needles, syringes, and caps in the proper sharps containers. Remember, the sharps containers, they're red containers. You're going to put all your needles and syringes in there. And again, once you pull the cap off the needle and you're working, you attach it to a syringe. Let's say this is the syringe. I don't have one right here with me. At the end of using the needle and syringe, never recap. Okay, never recap. That's a no-no. You just want to throw it into the sharps container. I should, before I poke myself, I should put this back. 5.3, risk management guidelines and regulations. Example, error prevention strategy. So medication errors are a leading cause of mortality, unfortunately, in the United States. Dispensing errors account for approximately 21% of all medication errors. Page 5 at the top. A, risk management. So pharmacy risk management goes beyond merely just putting the right tablets in the bottle with the correct directions on the label. It is even broader than protecting the patient from harm, although that must remain the primary focus of all pharmacists and you guys as technicians. Risk management means managing a wide spectrum of risks that could affect the practice of pharmacy, and it involves the protection of the patient, protection of the pharmacists and technicians, and protection of the pharmacy staff. B, error prevention strategies. include programs to address errors that include CQI, right, Continuous Quality Improvement Program, that is part of the pharmacy's overall, get ready to write this in or type it in, Pharmacy Quality Program, PQP, that is part of the pharmacy's overall pharmacy quality program. 1. Pharmacy risk management needs to look beyond medication errors and explore those risks associated with other quality-related events, QRE, in professional practice. Other risks include environmental and financial risks to the pharmacy. 2. We want to identify these risks and use the information to eventually prevent errors. Pharmacies should have their own program to address risks. C. 10 proven error prevention strategies for the pharmacy. 10 proven error prevention strategies. 1. Ensure correct entry of the prescription when you're reading it, when you're reading the prescription order. 2. Confirm that the prescription is correct and complete. 3. Beware of look-alike, sound-alike drugs. 4. Be careful with zeros and abbreviations. Remember the trailing zeros or leading zeros. 5. Organize the workplace. 6. Reduce distraction when possible. Don't do this. 7. Focus on reducing stress and balancing heavy workloads. 8. Take the time to store drugs properly. 9. Thoroughly check all prescriptions and make sure that the pharmacist checks it too. Let's go to page 6. And finally, number 10 is to always have the technician remind the pharmacist to provide thorough patient counseling. Really, the pharmacist shouldn't have to be reminded, but you can certainly help the pharmacist in case he gets really busy and maybe just has a brain fart or something. Okay, 5.4, communication channels necessary to ensure appropriate follow-up and problem resolution. For instance, product recalls and shortages. A, communication channels. Open communication is very important to foster a safe and trustworthy environment for all pharmacy team members. B, a process or program must be in place to ensure proper follow-up and to have a mechanism for problem resolution. Most importantly, managing the execution of the process is paramount in order for a program or process to work efficiently to activate the goals set forth in the objectives. C, examples of communication protocols. 1, drug product recalls. The drug product recalls are initiated by the, type it in or write it in, FDA, the Food and Drug Administration, or the drug manufacturer, or by the FDA order under statutory authority. The following terms are associated with with drug recall withdrawal processes. A Class 1 recall. This is a situation in which there is a reasonable probability that the use of or exposure to a violative product will cause serious adverse health consequences or death. This is the most serious type of recall, Class 1. A Class 2 recall is a situation in which use of an exposure to a violative product may cause temporary or medically reversible adverse health consequences, or where the probability of serious adverse health consequences is remote. And then 3, the 3 is the least likely. A situation in which use of or exposure to a violative product is not likely to cause adverse health consequences. Let's go to page 7. D, market withdrawal. So this occurs when a product has a minor violation that would not be subject to FDA legal action. The firm removes the product from the market or corrects the violations. An example of this was in the 1980s with McNeil Labs. They had a market withdrawal of Tylenol because the products were tampered with. Somebody was actually putting cyanide poisoning in the Tylenol and people were dying. So as a result, there was a new law that passed that all over-the-counter products had to have tamper-resistant, tamper-proof systems in place. Now, a tip, do not confuse Class 1, Class 2, and Class 3 recalls with Schedule 1, Schedule 2, and Schedule 3, 4, and 5. Okay, those are different. 2, in most situations, the drug recall begins with the drug manufacturer proceeding to the drug wholesaler, to the pharmacy, and finally to the patient. Once a drug recall is initiated, the following steps are observed. 1, receive the initial notification. 2, listing further action steps. 3, carrying out further notification. 4, responding to the initial notification. 5, handling the products. And 6, receiving reimbursement. 3, the pharmacy may learn of the drug recall or withdrawal from the drug manufacturer, a wholesaler, or from the chain pharmacy headquarters via letter, fax, telephone, voicemail, a pharmacy journal, an internet web page, mass media, or even from the patient. Hopefully not from the patient. The particular product is identified by a lot or batch number. Remember, all products have a lot number with its expiration date. A lot number is an alphanumeric combination that identifies a specific batch of medication produced at a specific time by the drug manufacturer. All drug products must have a lot number, otherwise you can't identify it if it was recalled. 4, shortages. So shortages are addressed by corporate policy and procedure manuals. Several mechanisms can cause shortage to the pharmacy, including billing errors, drug diversion, improper inventory accounting, and improper receipt of drugs from wholesalers and vendors. Let's go to page 8. A, controlled drug or scheduled drugs shortages are handled differently than non-controlled. Shortages of controlled substances must be reported to the DEA quickly. I think it's 24 hours, right? On Form 106. Due to theft or loss. Now this is different when destroying controlled drugs, in which you have to get a Form DEA Form 41. So Form 106 is to report shortages due to theft or loss, and Form 41 is when you want to destroy controlled substances. Okay, 5.5, productivity, efficiency, and customer satisfaction. A, productivity and efficiency. 1, productivity is often determined by following their policies and procedures manual or P&P manual for workflow efficiency processes. 2, every pharmacy, including chain pharmacies and hospital pharmacies, will have their own proprietary workflow processes to maximize product productivity and efficiency. In other words, they all have to have their own P&P or policies and procedures manual. If a state board inspector came in, that's one of the things they're going to look at. They're going to say, where's your policy and procedures manual? A, workflow processes include mapping of the pharmacy space for different stations, specific processes that are carried out by specific pharmacy personnel, pharmacy software designed for workflow efficiency, and effective communication between pharmacy team members. So every pharmacy has their own workflow efficiency processes. They may have like several, if it's a bigger pharmacy, they may have several workstations where one workstation is for just taking the pharmacy taking the patient information for the pharmacy. Another station may be for DORs, and another station may be just for order entry. And so these are all usually proprietary or custom for each type of pharmacy. B, most chain pharmacies have proprietary pharmacy software systems. Walgreens, CVS, Rite Aid, they have their own proprietary pharmacy system that coordinate workflow with the pharmacy teams so that a prescription can be found in the workflow step process. So that way they can see, is it already been filled? Is it on the shelf? Is it in a DUR? Is it in third-party rejects? They'll be able to find where the drug is, where the prescription is, somewhere in their workflow process. Now this can be anywhere from take-in, like I said, pulling drugs, count and pour, pharmacist verification, to bagging the prescription and placing on the shelf. 3, customer satisfaction. So customer satisfaction is a good beacon as to the efficiency and service level that your pharmacy provides. Customer service is the foundation for the success of a pharmacy organization. If you're mean to your customers or patients, they're not going to come back. Okay, so it is essential that you guys give great customer satisfaction. Remember, always start with a smile. It is the customers or patients who determine whether a pharmacy becomes profitable or not. In other words, whether they go out of business or not, and whether they're going to have a lot of sales to make themselves profitable. A, greet the customers appropriately. Let's go to page 9. Again, smile. It's cheap. It doesn't cost you anything. 2, speak and act sincerely. Take some interest in your patients, your customers, and show some empathy. Remember, they're coming in and they're sick, right? Or they have some kind of disease. 3, look at your customer attentively. So always look at them. You don't have to like stare them in the eye or anything, but know that you have some interest in them by looking at them, at least in the face. 4, introduce yourself and ask for your customer's name. Always know their name and let them know your name. You want to get that personal one-on-one relationship with them. 5, build trust and establish a personal relationship with your patient over time. 6, refer customers to the pharmacist to address any questions outside your scope of practice. B, pharmacist consultations. Consultation is required for any of the following situations. 1, a new prescription. Always new prescriptions require consultation. A new prescription that a patient has not previously taken. 2, a new prescription or a refill when changes were made from previous dispensing. 3, prescription or refill that flags a drug utilization review. And 4, request by a customer or patient to speak with the pharmacist. Okay, everyone, that ends a 5.0 Pharmacy Quality Assurance for the Blueprint. And we will see you in 6.0. Thanks.